Media Briefing. I'm Rachel Sims, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have LACY FEHRENBACH, Deputy Secretary for Prevention and Health, Michelle Roberts, Assistant Secretary for Prevention and Health, Dr. Tao Sheng Quanget, Chief Science Officer, and Nate Weed, Deputy Secretary for Emergency Preparedness, Resilience, and Response. To begin today's briefing, we'll open with remarks from Deputy Secretary LACY FEHRENBACH. I appreciate everyone's patience while we're having some technical issues. It looks like LACY is having a problem with audio. Please hold on just a moment. Thank you for your patience as we've been dealing with some technical difficulties, and we will begin with Deputy Secretary LACY FEHRENBACH.
Good morning. Can you all hear me now?
We can.
Okay. Thank you. Good morning, everyone. Again, apologies for the technical difficulties. Thanks for struggling through with us. I'm LACY FEHRENBACH. I'm the Deputy Secretary for Prevention, Safety, and Health at DOH. Dr. Shaw could not join us today. He extends his gratitude, and we all extend our gratitude for you taking time to be with us today. We have a number of timely public health topics to talk with you about today. I'm going to start with reproductive health. The U.S. Supreme Court's decision on June 24th turned the decision-making around access to safe abortion care over to states. It is expected that roughly half the states in this country will move to restrict or ban abortions. I want to say from a health perspective, this decision will be harmful to the health of people seeking reproductive health care in our country and will worsen already stark inequities that we see related to pregnancy and birth outcomes. The science is clear that offering comprehensive reproductive health care leads to better health outcomes. Policies that limit or restrict access to abortion care increase rates of unsafe abortions. Studies also show that the ability to choose if and when to have a child impacts an individual's educational attainment, their economic success, and their future relationships. And there are lifelong impacts to their health and the health of their family related to those social determinants of health. Additionally, we should all be concerned that the inconsistent availability of healthcare worsens inequities for people of color, people with low incomes, people with disabilities, people who live in rural areas, and LGBTQ+ people. So this ruling will make it even harder for those who already struggle to feel welcome and supported and safe using our healthcare system. Abortion continues to be legal in Washington state despite the Supreme Court ruling, and at DOH we work to make sure that sexual and reproductive health services are available and accessible across the state. More than 50 years ago, a voter initiative legalized abortion, and another voter initiative in 1991 protected the fundamental right of privacy with respect to personal reproductive decisions. Washington law is clear that you have the legal right to choose an abortion, you have the legal right to decide to have a child, and no one can make that decision for you, even if you're under 18 years of age. If you need abortion services, the Northwest Abortion Access Fund and the National Abortion Federation maintain lists of providers in Washington state. We are planning to see an increased demand for abortion in Washington state as as a result of the decision to overturn Roe versus Wade. And we are working very closely with our network of providers and reproductive health partners to ensure access to the continuum of care, including abortions, for anyone who may come to Washington state. I also wanted to note that we do a broad, comprehensive sexual and reproductive health program that has 87 clinics across the state. Not all, but a number of them do provide abortion services. That program is everything from birth control, STI services, preventive care, as well as abortion care. In 2021, the program served a total of 86,380 clients. Nearly half of these were racial or ethnic minorities, 45% were at or below the poverty level, and 15% had no other source of healthcare coverage. The program provided contraceptive care to more than 66,000 people, and it is estimated that that prevented 14,000 unintended pregnancies, 6,690 unplanned births, 4,810 abortions, and 2,710 miscarriages. As I mentioned, we also provided STI services and other types of preventive care. Collectively, the services offered in this program resulted in more than $75 million in savings to the government. I did mention that not all of our providers do abortions. There are 5. Again, if you go to our website, you can get more information about that. We just want to make sure that people understand their rights here in Washington state and that really reinforce that they have access to the full continuum of care for reproductive health services here in Washington. And with that, I will turn it back to you. Thank you.
Thank you, Deputy Secretary FEHRENBACH. Next, we'll go to Assistant Secretary Michele Roberts.
Good morning, everybody. I'm Michele Roberts, and I lead the state's COVID-19 vaccine planning and distribution team. It's great to be back with everybody this morning. We've made a lot of progress on vaccinating people living in Washington, with nearly 75% of those 5 and older fully vaccinated. Now the focus shifts to young children. I'm really excited to share that we have vaccination in our communities happening for kids that are under age 5. Vaccination is now recommended for everyone age 6 months and older. As of June 27th, more than 7,000 children aged 6 months through 4 years have started their vaccination series. This is an initial look at the data. These numbers come just 1 week after vaccination began for this age group. Let's take a look at the dosing schedule for young kids and with the COVID-19 vaccine. There are 2 vaccines for kids in this age group, and they do have a different amount of doses recommended and a different schedule of timing. So your healthcare provider will have this information, but we're going to walk through it too, just so everybody knows. Kids age 6 months through age 4 will get a 3 doses of the primary series of the Pfizer-BioNTech vaccine. The first and second dose are separated by 6 to 8 weeks, with the third dose coming at least 8 weeks after the second. For those who are moderately or severely immunocompromised, the first and second doses are separated by 3 weeks, and the second and third doses are separated by at least 8 weeks. So let's talk about the Moderna vaccine now. The Moderna vaccine is given in a 2-dose series, 4 to 8 weeks apart. For severely immunocompromised kids, doses are given 4 weeks apart, with a third dose given after an additional 4 weeks. So far, Washington State Department of Health has received a total of 173,000 doses of COVID vaccine for kids aged 6 months to 4 years. That vaccine did arrive throughout the week last week. So we now have all the vaccine that was ordered in the state, and providers are adding more and more appointments to make sure kids have places to go to get vaccinated. I do want to mention that when it comes to kids age 5 to 11, less than a third of that group has been fully vaccinated against COVID-19. This is a big concern for us, and it's why we're working hard to be sure parents have information to know why we are strongly recommending they vaccinate their child. So it is really critical for kids to get the vaccine. The Department of Health strongly recommends that parents and caregivers use this time away from school to initiate complete the COVID-19 vaccinations for all eligible children. So once again, that's all kids age 6 months and older. We want to remind everyone that the idea that COVID-19, or it's a myth really, is always a mild disease is a myth. It is not true. Nationally, more than 4.8 million kids have been diagnosed with COVID-19, including 15,000 hospitalization and 180 deaths. Remember, Washington provides all recommended vaccines at no cost for kids through age 18. You can ask your pediatrician or regular clinic if they carry the COVID-19 vaccine. Parents can also call the Help Me Grow hotline at 1-800-322-2588 if they don't have a healthcare provider already. Kids age 5 and up are eligible for a booster dose of vaccine as well, 5 months after their primary series. Immunocompromised children should get a booster after at least 3 months. Everyone age 12 and older should receive a booster dose 5 months after completing their primary series of Pfizer vaccine, or 2 months after receiving the single-shot Johnson & Johnson vaccine. Getting vaccinated and staying up to date on your vaccines continues to be the best way to protect yourself and those around you from COVID-19. Can we get the slide pull up about the vaccine locator? To find vaccine locations near you, visit the state's vaccine locator website or vaccines.gov. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Chief Science Officer Tao-Shen Kwang-Get.
Good morning, everybody. I'm Dr. Tao Kwang-Get, Chief Science Officer, and Assistant Secretary Michele Roberts has given us a great overview of pediatric vaccines, and I'm here to share with you some data on COVID-19 in kids to give more data to support why vaccinating children is so important. I'll also give a brief overview of the latest data and trends on the pandemic, as well as share an overview and update of where we are with monkeypox virus. So as Michele mentioned, the notion that COVID-19 is always a mild illness in children is a myth. True, rates of hospitalization and death for COVID-19 among kids remain much lower compared to other age groups. However, when you look at the cumulative impact the pandemic has had on children, it becomes clear that COVID-19 is a significant health issue for kids. In Washington, More than 1,700 children, 17 years old and younger, have been hospitalized for COVID-19 since the beginning of the pandemic. 17 children, 17 years old and younger, have lost their lives due to COVID-19. 110 children under 17 in Washington have developed multi-inflammatory syndrome in children, or MISC, a condition where different parts of the body can become inflamed, causing a serious, sometimes life-threatening illness. And an unknown number of children have long COVID, an illness that the medical community is still working to fully understand. Nationally, another way to frame pediatric COVID-19 is to look at how deaths from COVID-19 rank compared to other causes of death in children. One study from the Kaiser Family Foundation found that in January 2022, COVID-19 was the fourth leading cause of death in children ages 5 to 14 years. So while COVID-19 is usually a mild illness in children, the risk of serious illness and death is small but significant, and getting vaccinated is your child's and your family's best defense against COVID-19 infection. I'd like to move onwards now to talking about general COVID-19 trends for our entire population of all age groups, compared to our last briefing the week of May 21st. So currently we're seeing a slight decline in cases with the latest available data from June 12th. Although it's important to know that at this point, due to self-testing and other factors, such as some people not testing at all, the cases that are reported to the Department of Health are likely only represent less than 10% infections in Washington. Our primary focus at this stage remains on watching for serious disease, so we follow rates of hospitalization closely to assess the stress on our healthcare system. And as you can see in this graph, we have seen a slight uptick in hospitalizations across the state since our last briefing in May. But fortunately, the curve for deaths remains stable at this time. It's important to know, however, that hospitals and emergency departments are reporting significant stress due to a combination of factors such as workforce shortages and difficult to discharge patients. So practice recommended COVID-19 prevention measures, not only to keep yourself from possibly needing healthcare, but also to prevent infections amongst healthcare workers in the community. And don't use the emergency department unless you have a true emergency. I'd like to shift now to talking about monkeypox. And let me start first by saying that the risk to the public remains low. Monkeypox virus, or MPV, is a virus that is an orthopox family of viruses and usually causes a mild illness that gets better on its own. The illness often begins with fever, headache, muscle aches, backache, swollen lymph nodes, a general feeling of discomfort and tiredness. A few days later, the person develops an unusual rash. The rash usually turns into raised fluid-filled bumps, which then scab over and the scabs fall off. Currently, there's no specific treatment approved for MPV, but fortunately, almost all cases of MPV cause only mild illness that gets better on its own, and severe disease requiring hospitalization is rare. The World Health Organization reports 1 death as part of the global outbreak, and here in the United States, there have been no deaths from MPV infection as part of this outbreak. For people with severe disease or people at high risk of developing severe disease, there are some antiviral medications that may prove beneficial. To prevent the spread of MPV, people who have had close or intimate exposure to a person with MPV infection might be advised to get a vaccine to decrease their risk of developing monkeypox illness. Because of this, it's important to identify people who are exposed to MPV. Until now, the recommendations for MPV vaccine have been limited mostly to people who are known to have had close or intimate exposure to a person with MPV. Yesterday evening, our federal partners announced the first phase of a new national monkeypox vaccine strategy. With the new strategy, the recommendation for MPV vaccine is being expanded in 2 phases. The first phase will add those individuals who are presumed to have been exposed to monkeypox, even if an exact exposure has not been identified. And in the second phase, availability will be further expanded to include individuals at higher risk of exposure to monkeypox. The new strategy also includes expansion of MPV testing to make it easier and faster to identify new cases in the community. The good news is that we have no shortage of testing capacity for orthopox virus in Washington state. Our public health laboratory has had the capacity to test every single suspected case that medical providers in our state have reported to their local health departments, and we will continue to test cases that come up. And so far, we have tested 39 people and have identified 6 cases. We encourage anyone who has a rash and thinks they may have had close skin-to-skin contact with someone who could have had monkeypox in the last 21 days to talk to their medical provider and find out if they should be tested. These new strategies to combat monkeypox were announced yesterday evening, and more information will be available soon. In the meantime, the Department of Health will work with our federal partners on the details of expanding vaccination and testing, and we will coordinate with our local partners and healthcare partners on implementation. In the meantime, people should become familiar with the symptoms of monkeypox and see a healthcare provider if those symptoms develop. To prevent MPV infection, avoid skin-to-skin contact with anyone who has a rash that might be monkeypox, wash hands frequently, and avoid handling the bedding, towels, or clothing of someone ill with possible symptoms of MPV. And we'll be sharing more details about MPV as they become available. So I'll turn now to Secretary LACY FEHRENBACH.
It appears we may have lost Secretary FEHRENBACH. So in the meantime, let's go ahead and move on to Deputy Secretary Nate Weed.
Yeah, good morning and thank you for having me. My name is Nate Weed and I am currently the Acting Deputy Secretary for Emergency Preparedness, Resilience, and Response here at the Department of Health. And I wanted to just take a moment and talk a little bit about summer safety and some of the things that we may be experiencing over the next few months and certainly over the next weekend. We know things have cooled down a little bit after Washington's first heat wave this summer, but due to the climate change crisis and the impacts that's having on the weather systems in Washington, it's safe to say that we can expect to see more frequent and more intense heat events. And it's important to be prepared because really a little bit of planning can make a big difference in how we all experience these events. Additionally, we have the holiday weekend coming up, and there's a lot of things that are great about our state, especially some of our rivers and lakes and places we can go outdoors. But I want to talk just a little bit too about how we can stay cooler and stay safe at the same time. So the air is definitely a little warmer right now, and this is wonderful. But the water is still very cold, and many of our rivers are running fast and high due to our rainy spring weather. Swimming in open water, even for really competent swimmers, is different than swimming in a pool. And hypothermia can quickly set in cold water, which raises the risk of drowning. Sadly, last weekend was a deadly one for swimmers. A 4-year-old, 13-year-old, and a 20-year-old died in separate incidents in Western Washington, and currently a 12-year-old and a 15-year-old are in critical condition. So please wear a life jacket that fits you, make sure your children are wearing proper life jackets, and always supervise young children when playing in or near the water. Additionally, I encourage everyone to check the advisories and closures for your favorite swimming beaches. In most cases, you can visit either the Department of Health website to view an updated map, or you can check with your local health jurisdiction. You can also find more information about freshwater swimming lakes on these websites. So moving on to heat, whether it's hot or not, please remember to drink plenty of clear fluids. And when we say clear fluids, we are thinking water in particular, things like caffeine, certainly a diuretic, and makes you less hydrated. And alcohol has a dehydrating effect as well. So please try to stay as hydrated as you can during the summer months. And if you are in a situation where the heat rises and you need to stay cool, we really do recommend trying to find some of the indoor air-conditioned spaces in your communities. And you can check for cooling centers in your area when the temperatures really get into those hot temperatures. Additionally, we always recommend finding a good library if the day is really hot and spend some time reading. It's best if you wear lightweight, light-colored and loose clothing when it's hot out, and don't forget a high SPF sunblock. Avoid being outside during the hottest part of the days if you can, and again, and maybe this is just because I have a lot of freckles, don't forget the high SPF sunblock. As Dr. Kwan Get mentioned a moment ago, we have a situation in our state where our hospitals are really stretched to capacity. And some of this has to do with COVID, but some of this is really not to do with COVID. And we want to make sure that if people do need medical care, they can get medical care. The summertime and the 4th of July weekend in particular tend to be very busy times that stress our hospitals and emergency departments even further. So we really do ask you take the extra steps and do the extra planning to be safe throughout the summer. With these stresses on our healthcare system, which includes emergency medical services, we need to be aware that they may not be able to respond as quickly as in the past. And being safe can really help you and your family out of the emergency department. So to do some of this, we really encourage folks to pay very close attention when using any sort of fireworks. Fireworks injuries are preventable, and we really encourage people to watch from a safe distance. Additionally, we ask that folks really supervise children and don't let young kids ignite fireworks. Make sure you check any restrictions or warnings before lighting fireworks. There are a number of warnings in many communities across the state, or better yet, we really think watching one of the professional fireworks displays that are planned around the state is a wonderful way to spend the Independence Day evening. In conclusion, I'd just like to remind everyone to take those precautions while enjoying our beautiful Pacific Northwest summer. Check for water advisories before you head out, and always supervise children when they're in or near water. A little planning can definitely keep you and your family safer. And with that, I will turn it back to you, Rachel.
Thank you, Nate. This brings us to the Q&A segment of today's briefing. We do have a few media questions today. If we're not able to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question comes from Julian Lubers of the Spokesman Review. Is Julian present today? Okay, we're going to move along then to Nicole Jennings from Cairo News Radio. Go ahead, Nicole.
Good morning, everyone. We've been hearing that some hospitals are having to ration care right now. What can you tell us about that? Why is this happening, and how prevalent is this issue? And what are we going to do if there is another COVID wave and the hospitals get even more overwhelmed?
Thanks, Nicole, for that question. I'll ask Nate to jump in and share what we're seeing. I think you probably heard him in his remarks mention that the hospital system is stressed, and it's stressed due to a number of factors: delayed care, injuries, some COVID. So the first thing I want to say first and foremost is there are things we can all do related to COVID that will help limit transmission and also to help protect our healthcare system. So, you know, the first and foremost is being up to date on vaccination. The second is wearing a mask if you're in a crowded or confined setting. And certainly if you're around others from outside your household and you're not up to date on vaccination. The third, if you're gathering, if it's 4th of July or a family reunion or anything else, if you're gathering, do as much as you safely can outdoors, weather permitting. And if you need to be indoors, do what you can to maximize the ventilation and spacing between people. Thirdly, consider testing beforehand, before any gathering or event, before and after any travel you may do this summer, and of course, anytime you have symptoms. Fourth, I think I'm on fourth. Stay home if you're sick. Stay home from school, stay home from work, stay home from conferences, whatever, stay home from gatherings, whatever it is you might be going to. If you feel sick, COVID or otherwise, please stay home. If you do have COVID symptoms, we strongly encourage you to get tested. And if you are at risk for severe disease, to access testing. And there is a website maintained by HHS that will help people access antivirals if they're eligible. Nate, do you want to share what we know about the healthcare system?
Yeah, the healthcare system in Washington is lower capacity than I think we wish we had for a population the size of Washington. And we experienced situations where hospitals were running into very, very limited capacity prior to the COVID pandemic. During the COVID pandemic, we certainly saw waves of disease that were driving that capacity even further to the edge. And we saw hospitals activate their emergency response plans and do some amazing things to make sure that patients in our state still got the care that they needed during the pandemic. As we're moving into this phase, certainly the COVID pandemic disease rates are still impacting hospitals, but so is the delayed care for people who haven't been going to hospitals, even though maybe they might have had something that was going on. The seasonality as we're moving into this time of year, of course, often we see more injuries. This bumps up the use of hospitals, and all of our hospitals have emergency response plans and systems that they use to help manage that increase in patient care. Additionally, as a state, we have systems that allow us to help balance the patient load between hospitals. So moving patients to where care is available so that they get the right level of treatment that they need. And we conserve that healthcare capacity across the state. Hopefully I got your question there.
Thank you, Nate. Nicole, would you like to ask a follow-up question?
Yeah, I'm just curious how prevalent this is. I mean, is every hospital having these problems? And I just would love to know kind of a few more details about what this looks like on the ground, what sort of care is being limited.
Yeah, thanks for that. Okay, so when we look at a lot of our regional hospitals, our regional tertiary care centers, they're probably the most impacted by this right now. We know from the systems that we use to track hospital capacity that there is space available in some of our critical access hospitals, and there is space available in some of our larger treatment centers. The trick is that a lot of those regional hospitals really are where people go from more rural communities to seek higher levels of care. Again, the systems that we really use to help manage this are those load balancing systems that allow us to help transfer patients from those facilities either to a critical care hospital where they would have access to the level of care they need there, or to a larger urban medical center where they might have the care that they need there. Again, all of our hospitals have been under a lot of stress over the past 2 years and are experiencing very constrained staffing. They're experiencing very constrained space, and really do need all of our help at doing what we can to prevent disease, prevent injury, to stay safe during the summer, to get our vaccines for COVID, and to do the things that will keep our families and ourselves as healthy as possible.
Thank you, Nate. I'm not seeing our other reporter in queue who had submitted a question. I did briefly see a hand up from Elaine Stefanowicz. Elaine, would you like to ask a question?
Yes, thank you. I must have bumped it to put it down. Sorry again about that. I was wondering if there's any new guidelines for summer camps and COVID safety. I see one that's maybe a year or two old, but I didn't know if have been any updates to that.
Thanks for the question, Elaine. We did do some updates this spring, and I will check back with our team to make sure it's easy to find the latest version of the summer camp guidance on the website. So there's guidance for day camps and guidance for overnight camps.
Okay, great. Thank you so much. I appreciate it.
Thank you, Elaine. Next, we'll go to Graham Johnson. Go ahead, Graham.
Good morning. Thank you so much. I'm wondering if you might be able to speak to the bigger picture. Sorry, I think I was muted there still. Good morning. Thanks for taking the time. I apologize. I'm wondering if you could speak to the larger picture about other respiratory viruses going around right now. We're getting a sort of an anecdotal sense from folks that, a number of folks are feeling sick but testing negative. They're finding a lot of sort of allergy medicines and relief not available on the shelves. I don't know if you could speak to if you have any sense of that supply chain, but just also kind of what else is going around that may be sort of complicating the COVID picture, perhaps. Thanks.
Sure, Dr. Kwan-Get, I'll let you add to this. We are seeing a lot of respiratory viruses beyond COVID here in Washington State, including a pretty late flu season and adenovirus among them. Dr. Kwan-Get can probably add some details to that.
Yeah, thanks. That's a really good question and very significant because these respiratory viruses all cause many of the same symptoms. And so it's often difficult or impossible to tell the difference between them without testing. But yes, as Secretary FEHRENBACH mentioned, influenza did appear later this year, had a wave later this year than we typically see. Fortunately, it's on its way down. But there are a variety of other respiratory viruses around that include rhinovirus, adenovirus, parainfluenza virus, to name a few. So we do have surveillance systems that track the prevalence of these different respiratory viruses. We're mostly concerned about the impact of respiratory viruses in the wintertime when we usually see increased activity and often it's during that time that we see the respiratory viruses cause a lot of strain on our hospital system. Thanks.
Thank you, Tao. Next, we will go to Julian Lubers from the Spokesman Review. Julian, go ahead.
Hi there. Thank you very much for taking the time. I was on the, sorry, I got the wrong link and was on the public live stream for a little while. And so I think I might have missed this if you mentioned it, but with regards to the newer variants of COVID and as it continues to mutate, what are the current dominant variants of COVID in Washington, and how does the DOH test between them and figure out what is the active current variant?
Thanks for the question, Julian. I think Dr. Kwan-Get can add here. We are always sequencing a portion of our positive cases here in Washington State. We do that in our public health lab and with a very large number of partners who help us with this. And that tells us, those genetic sequences tell us what the prevalent strains are and what the dominant strains variants and subvariants are here in Washington State. So our first Omicron wave was BA1, and then in the late winter, early spring, we saw an uptick of BA2, and then and it became the dominant subvariant. And then in May, we started seeing increasing activity of BA2.12.1, and now we're seeing increasing BA5 and some BA4. I think the important thing to note is that from a clinical perspective, we're not seeing huge differences in disease. What we have noticed and are dealing with is that each of these subvariants are more transmissible. Dr. Kwan-Get, anything you want to add?
I think you hit all the high points, LACY. Yeah, as right now we're seeing a variety of variants. The last I checked, there was no one single dominant variant amongst the different Omicron subvariants. But as Secretary FEHRENBACH mentioned, we don't have any data to suggest that these variants cause more severe disease. And so it doesn't really have any impact on you if you are infected, what variant you have. The important thing is if you test positive, if you have chronic illnesses that place you at risk for severe disease, that you contact your healthcare provider right away, because there are antivirals that are effective against COVID-19, against all of the variants that are currently circulating, that can significantly reduce your risk of hospitalization, up to 90%. But these antiviral medications have to be started within 5 days of your first symptoms. So if you are at high risk for severe disease, be sure to contact your healthcare provider right away to ask if you might be eligible for one of these antiviral medications. Because if you are, then a prescription can be written, you can start it and reduce your risk of severe disease or death. But fortunately, as I mentioned, we're not seeing evidence right now that any of these subvariants that are appearing cause more disease than earlier Omicron variants.
And one other thing, Julian, we do issue a regular report on what we're seeing from our sequencing data. So we'll have the PIOs follow up with the link to that report for you.
Right. Thank you, Dr. Quanget and LACY. Finally, our last question in the queue is Eilish O'Neill from KUOW. Go ahead, Eilish.
Thanks for taking my question. I am wondering if you can speak to what you're seeing in terms of vaccine availability for the under 5 set. I'm hearing anecdotally from some parents of very small children that they're having trouble getting an appointment. So I'm wondering, what are you seeing statewide in terms of vaccine availability, and when do you expect kind of that that all the parents eager to vaccinate their small children will be able to access their first dose?
Thanks for that question, Eilish. We're very interested in getting vaccine out to everyone who wants it in this age group. I'll turn to Michelle. I think, broadly, anytime we have a new presentation of the vaccine or a new dose size of the vaccine, there's an initial ramp up period as it becomes available, and that's likely what we're seeing here. But Michelle can add some details.
Yeah, thanks, LACY, and great question. That is exactly what's happening. We did have some delays in vaccine delivery last week that were happening at the federal level, but impacting when vaccine was arriving in the state. So a lot of the vaccine that was pre-ordered, and I mentioned that was around over 170,000 doses of vaccine. So it took through last week to get into the state. So that could be one of the drivers behind some of this anecdotal information, that it took a while for all the vaccine that was pre-ordered to arrive in the state. It is all here now is the good news, but some healthcare systems and providers are continuing to get their clinics up and running. And I've heard like some healthcare providers may just be offering vaccine a certain days of the week. Most county local health departments and other partners do have broader options. Like here in Thurston County, there's an ongoing clinic at the Capitol Mall. I know one of my staff who lives in Pierce County ended up bringing her children down here to Thurston County to be vaccinated because she could get in an appointment sooner. So that's just one example of, you may need to look a little farther than your own community if you want a vaccine appointment within the next week or so, but we'll see more appointments becoming available over the next couple of weeks as providers get, as the vaccine is now here and providers get their appointment schedules set and up and running.
Thank you, Michelle. Eilish, would you like to ask a follow-up question?
No, that's perfect. Thank you so much.
All right, thank you. This concludes the question and answer segment for our briefing. We'll go to Deputy Secretary FEHRENBACH for closing remarks.
Well, thank you all again for your continued coverage of the pandemic and public health. We're very grateful for our partnership with all of you in the media. We, of course, want to wish everyone a healthy and safe Independence weekend. and month of July as we roll into the next phase of summer. As mentioned by my colleagues, myself, please do what you can to be safe, to protect yourself and your family and our healthcare system, whether that is being safe with regards to COVID, being safe with regards to heat and sun, or even your food safety. A reminder that lots of these gatherings and summer events involve potlucks and picnics and barbecues, and we don't want you to get foodborne illness either. That's a terrible way to end a celebration. So please, when you're cooking, preparing food, wash your hands, sanitize your cooking surfaces, make sure you keep your hot foods hot and your cold foods cold, and don't let anything sit around for more than 2 hours. After that, put it in the refrigerator, reheat it, or toss it. And then if you're going to eat shellfish this summer, please check our shellfish safety map at the DOH website before you go to harvest, and cook them to an internal temperature of 145 degrees. And then lastly, if you do unfortunately get foodborne illness, please work with your healthcare provider to get that reported to your local health department. We want you all to be safe, healthy, feel well. And with that, I'll just wrap up by saying you're probably noticing that we're changing the format up here a little bit and including other public health issues beyond COVID, and also including COVID. So I think you can expect that going forward as we move together and in our journey to recover from the pandemic. So I want to thank my colleagues on the panel. I want to thank our communications team, and most importantly, I want to thank you all for your coverage and your time today. Have a good day and a pleasant weekend.
Thank you, Deputy Secretary. This concludes today's media availability. I'd like to thank our panelists for their time today and TVW for hosting today's live stream and archives of past briefings. Thanks, everybody. Take care.